Senator Blunt, thank you. Mr. Secretary, thank you for being here. I don't know you as well as I'd like, and I look forward to developing a strong relationship. There's so many things within your department that are so important to the citizens I represent. And this may be me doing more talking than you, and I apologize for that, but I want to highlight some things that in your budget request that are, in my view, worthy of my reaction. First of all, NIH. The budget that is before us is a $6 billion reduction in NIH funding. I would indicate to my colleagues, and certainly to the ranking member and chairman of this committee, that we ought to continue our efforts in finding ways to fund NIH at increasing rates and certainly without reductions. I think we, in a broader sense, I think we as a Congress for a long time have focused on who's going to pay for health care as compared to how can we make health care less expensive. The focus is how do we shift unaffordable health care to someone else who it's still unaffordable for. And so it seems to me that the underlying cause of why health care is expensive is where we ought to focus, and you are doing that, and I appreciate that. And NIH, in my view, is one of those things. Not only does it improve people's quality of life and longevity, it's wonderful for families, but if we can find the delay to onset of Alzheimer's, if we can eliminate cancer, reduce diabetes, all those things have a tremendous cost consequence, and we ought to be pursuing them. In regard to the CDC, would advocate for continued funding of the Global Health Fund. One of the things that was said recently in the rescission discussion from OMB was that Ebola, in a sense, they were saying Ebola has been taken care of, no reports of Ebola. There were 2 reports from Congo shortly thereafter. But I also would say that regardless of reports of Ebola, we need to continue to have the funding necessary for the infrastructure so that we don't start anew. We don't have the crisis that we had when Ebola arrived. And for us, this is not just a problem in Africa or elsewhere in the world. The consequences of Ebola and other highly contagious, deadly diseases has a huge consequence upon Americans, and we saw that with Ebola. And so I would highlight the importance of not eliminating the infrastructure that's in place to fight these highly dangerous and contagious diseases, even though there may not be a report of that particular disease at the moment. So those 2 things I wanted to mention. I walked in as Senator Langford from Oklahoma was talking about drug pricing, transparency, PBMs. Senator Capito and I have long been supporters of legislation that requires transparency in the PBM world. I can tell you our legislation has not advanced very rapidly, and I would look forward to hearing from you, knowing from you how we can be assistance to you in your department's effort. But this issue of rebates that's now front and center, I think maybe our conversation is better had once the announcement from the administration occurs as to what your plan, what your policies are going to be. But this, again, is an example of where if we can find ways to reduce unnecessary costs in healthcare, we can, in the cost of healthcare, we can reduce the unnecessary costs of healthcare. So I applaud the department's efforts in regard to drug reform, and particularly as it relates to PBM transparency and the rebate issue. I'm encouraged. You and I visited on the phone, I guess it's now last week. I would highlight for you once again the importance of the 340B program. Our hospitals, from our largest and our most urban settings to our critical access hospitals, all of them are fragile. This is a funding source that helps the patient as well as the provider, and in your alterations, if there are any of 340B, I guess we're now waiting on the courts to tell us some direction, provide us some direction, but I would highlight the importance of this 340B program. There are 127 critical access hospitals, I said that wrong, excuse me. There's 127 hospitals in Kansas. 80 some of them are critical access hospitals. Almost without exception, it's hanging on by a thread. And any alteration in their reimbursement rate means that there is going to be less access to health care in rural places in particular, but in urban places as well, and particularly the core center of urban centers. And we have both in Kansas. From Johnson County as our suburbs of Kansas City, one of the smallest towns in our state is Johnson City. So from east to west, this is a huge issue. it highlights for me, I didn't realize when sequestration was passed that we had across-the-board cuts as they affected critical access hospitals. I thought sequestration would not apply to critical access hospitals. I didn't vote for sequestration, but as a bad policy, it's the wrong way to approach the appropriations process. But I would have never thought that we would reduce across the board funding that affects critical access hospitals that are to be paid cost basis. And it is this 2% across the board cut. We need, in my view, my colleagues and I need to make sure that this is not extended even further and look for opportunities for its demise. Perhaps the only last point I would make, Mr. Chairman, is tribal labor sovereignty, the words I use. Your CMS, Center for Medicare and Medicaid Services, has taken upon themselves to declare Native Americans to be classified, should be classified as a racial group rather than a citizen, as citizens of a tribe. I think you're wrong. I think tribes should be treated as and deserve the sovereignty that they are entitled to by our Constitution and our long-standing understanding that tribes are governmental, not racial. And I hope that CMS will take a look at that issue once again on behalf of the tribes. Thank you for answering all my questions, and at least I could say thank you for listening to my comments.
If I might, Mr. Chairman, we did just earlier this week revise that guidance on CMS, so we'll be happy to get that.
In regard to tribes? With
regard to the community engagement, and if you're talking about the community engagement participation in states that have received those waivers and tribal connectivity to that, we have actually issued modified guidance on that this week.
I'll take a look. Thank you very much.
Thank you, Senator.